Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. So today I will talk about anorexia nervosa. When you are going to appear in clinical exam of MRCPCH, you might face the communication station with the scenario of anorexia nervosa. So how you should approach this station, what question the role player may ask, and how you should reply. So first of all, I would like to tell you in details what is anorexia nervosa. Before you know the how role player is asking question, it's important to know about the topic. So what is anorexia nervosa, how they may present, what is the treatment? I would like to talk about anorexia nervosa. So before I going to start, please subscribe my channel and for the further interesting videos regarding MRCPCH clinical exam, and it will really help you and guide you that you can pass in first attempt. So what is anorexia nervosa? Also called it is anorexia, and as you know, it could two options are there. First is that is it a eating disorder or it is a mental health condition. So it is a both. So it is a eating disorder and also it is a serious mental health condition as well. So people who has this condition, usually they are losing their weight, and they are not losing their weight only, but they are stop eating. They sometimes they use drugs as well, like laxatives, medicine for like laxatives, try to make them sick so that reduce the weight. And it is not like that they are doing themselves, but they are thinking that we are fatty, we looks bad, our body shape is not good, and whenever they are seeing themselves in the mirror, they think that we are fatty, we need to reduce the weight. And it is the mental condition, you cannot blame them that they are doing. So there are some risk factors, these 6 causes. So what are the causes, we will discuss as well. So it is the distorted image of their bodies, and they have thinking they are fat, and that's why they are doing the things which make them underweight. So usually it is teenage girls, they are the mid-teens, they are the one who are mostly suffering commonly, but it can happen with anyone. So how they feel, it means what are their symptoms, what are their signs. Definitely, as I told you, it usually in the mid-teens, usually in 13 and 18s, and it has a very low BMI. They miss meals and sometimes they eat very little, and also they are thinking that whenever they are eating, they don't eat the fatty food and they become calorie conscious, even though they are very thin, but they are even though they are underweight, but they believe that it is a fatty food, maybe I will gain the weight. So usually if it is a teenage girl, they will miss the periods as well, and they feel lightheadedness, dizzy, hair loss, they might have the dry skin. So these are the symptoms, and you might feel that their BMI is very low. So this is their presentation, and when someone who is telling them that you are looks very thin, they look at the mirror and they think that it is she thinks that I'm fatty. Sometimes even they use the diuretics to make their weight is still more low, and sometimes they use laxative as well. So these are the presenting complaints you might have. They might have the health risk, as I told you, of anorexia nervosa, that it is a eating disorder, and they might lose their hair, their hair loss, their skin become thin, they have the electrolyte imbalance, they have lightheadedness, they have the dizzy because of feeling dizzy, and their skin become very dry, and it is because of their uh, problems in their vitamins, nutrients, because they are not, their diet is not proper. So when they are presented to you with these symptoms, so definitely you cannot leave them like this. It is the condition, there are some risk factors, exact cause as you know. that it is unknown, but there are some risk factors we should have to address. Like for example, they have the mental condition like anxiety, depression. They are anxiety, depression. You should have to treat these things. This is the mental health condition, and you should know that those girls are not. They don't speak in front of anyone. Any child, any teenage girl who comes to you for the help of because of their mental problem, because of their psychological problem, and as a doctor you should know they may be open up to you, but they cannot open to the parents, to their friends. Sometimes they have the issue of bullying, sometimes they have issue of very difficult family circumstances, sometimes educational problems, sometimes siblings issues. So some definitely some teenage, they are very sensitive, they cannot tolerate, and whenever they are bullying by their siblings, friends, or sometimes even parents, they are very sensitive and they cannot say anything, but inside their mind, inside their brain, they are developing the things. So if they if they were very fatty, their BMI was high, and they were bullying at school, so or with their siblings or parents, definitely they want to reduce the weight. Once they start to reduce the weight, it's okay for somehow, but if they are continuously bullying or their thinking way is different, then definitely they will go to the anorexia nervosa. So there are treatments as well, and as I told you, there are some risk of other condition if they have the anorexia nervosa. For example, they are feeling tired, they might have the osteoporosis and hypotension. They have even sometimes they might develop the heart failure, and they have the edema in the feet and the legs, and they have the anemia. Definitely because of that they develop the easily tired. They might have the kidney problems, they might have difficulty in concentration, they might develop the seizures, fainting attacks. So these are the risk in the teenage girls who are suffering with anorexia nervosa. And usually the uh, those girls who are, sometimes they are public influencers, like for example YouTubers, like they have the public influence, and public speakers like the stage performer. They are also high risk of developing anorexia nervosa. And if they are developing anorexia nervosa, definitely in exam setup, now I will tell you in exam setups you how you can get the uh, in communication scenario, communication situation, how would you get the scenario. So in exam you might have the teenage girl who has a fainting attack multiple times, and now came to the emergency department, and you want to admit her because she is a very low BMI, she has electrolyte imbalance, and she is refusing at all that I don't want to be admitted. So how you should approach whenever you are seeing any girl, any scenario that girl is refusing, or not only girl, anyone who is refusing for admission. First of all, as you know in exam, first of all you should have to make the repo, introduce yourself, make the repo, and also you should tell them why you are there, what is your role. All these things you should have to say initially, and then you come up that why she is refusing for admission. You will tell her that we are going to admit you. The reason you should tell why you are going to admit. This is the first thing, and after that she will definitely she will deny. This is the scenario that she will deny, I don't want admission. Then you should come up why, what is the reason she is refusing. Maybe she will say you that I have to go with my friends. Maybe she tell you that I am fine. She can tell you that I am fine, I don't have any problem, it was just fainting attack and I did not eat, that's why now I will eat. So at that time you can say yes, we have monitored your growth, and your BMI is very low, you are very underweight, and we need some blood tests as well, your blood pressure is low, and if you will go from here it can happen again. So by this way, whenever she is telling anything, you should have to address this problem. You should have addressed this issue, that what is going on with her body. Then she might tell you that I have to go to meet my friends, I have to go to school, or I have to whatever meet my friends. Then you can say we will involve the social worker. Your friends can come and they can meet you here. It's not a problem. But doctor, I don't want to be admit. I have lot of work. I don't want to be admit because I have some school work, and they can give you any argument, and at that time you cannot force her. Like for example, initially try not to force her. If you will force the teenager, it means you are losing. So this is your job, how to convince her to be admitted. The forcing or by law or these things, many candidates are saying no, by law you have to admit, we have to admit you, it is your risk. No, don't say by law anything initially. You should try your best not to force her, do not threat her, and try to motivate her to be admit, and try to give her reasons why you are going to admit. If you will tell her by law forcefully, definitely she might feel that you are threatening her, and she might feel that you are forcing her. And forcing for the teenager, it's like the bullet, so it's not a good idea to force the teenager. So try your best to make give her a fruitful reply, so that she might give you a lot of argument. She might say you that I have the friends, I have a lot of work, I have, and she might say, she might open up to you that my parents are not good or something. So you should address these issues, and the reason of admission is what is the problem. Low BMI, underweight, dietitian, you need some test. It can cause electrolyte imbalance, it can cause the multiple health issues, and also you can say that this condition, you may lose your hair, you may have the dry skin, it doesn't look good for you, so it is better that we will treat it. So by this way, definitely she will be agreed to be admit and investigations. So this was little bit about anorexia nervosa. For further videos, you can subscribe my video. And if you have any topic you want to know, especially in communication station, not the other station, communication station, you can write in the comments, so that next topic I will just talk about that topic which you have difficulty. Thank you very much.